I'm excited to welcome all of you on the 16th TechNet Conference. That is, this time it will be virtual, as you know. But before we start, I just want to inform you that the conference will be in 3 languages, English, French, Spanish. So to switch to your language of choice, you have to use the menu as shown in the slide here, and then you can switch the other languages just to select your appropriate language. So note that only the speech will be in that language. The slide deck will still be on the original language, English. Yeah. Welcome back. Initially, we are planning to do this as traditionally a face-to-face, and the venue the organizing committee was proposing was Americas in Panama. Unfortunately, due to the COVID context with the confinement, we just changed our mind and tried to organize this in this virtual. And this will be actually the first virtual conference, TechNet conference ever we have conducted. So you can see the last picture we had from the last TechNet conference in Qashqai. So we hope, despite of the virtual, we'll still have the same excitement during discussion and the different presentations. So in the TechNet conference, where we are coming from, I want just to highlight that the first TechNet conference was held in Cyprus. This was in 1990. And I quote here John Lloyd's speech at the opening when he made an overview of the aims and objective of the first global meeting of logistics experts in the history of the EPI. He expressed the hope that this TechNet consultation will mark the beginning of an initiative to achieve better goals, communication in the development of logistics systems and resolution of technical problems. And definitely this statement has remained really the leitmotif, and it's that pave the subsequent TechNet we have been conducting. This slide is showing the geographical distribution of the 15 plus 1 TechNet conducted so far. As you can see here, all these dots represent each TechNet consultation. And the distribution is quite wide across all the continent, as you can see, with the exception that only one actually TechNet conference was conducted in southern hemisphere. Otherwise, all the other were likely being conducted in the northern. We hope that we will try to balance and to change this. The last TechNet conference was conducted in Qashqai with the theme of building next generation immunization supply chains. It was actually over 300 participants, and we have conducted a study just to asking the participants what they would like to see in the TechNet. The central word that was coming was the learning all sorts of innovations, technologies, networks, showcases, and monitoring and exchanging knowledge and experiences. So you see that there was a huge need expressed here in terms of innovation and technology, and more with LMS systems and networking in better communicating with the community. This 16th TechNet conference has selected 4 themes and will be conducted in 2 days, 20th October and 21st October. Each day we have two themes. The first day will be IIC, Immunization Supply Chain Strategies, with different presentation and sessions just to discuss. The second session will be responding to COVID-19, as this is the context now, and you will find very exciting discussion also in this. The second day will start with the effective vaccine management, not just the EVM, but the vaccine management as a whole area of keeping vaccine potent, available, and efficient. And the fourth will be the cold chain equipment. We're still continuing updating on new devices, new cold chain equipment that are available, efficient, sustainable, and easy to manage. Now where we are, and for the, the plenary session, I noted that this morning you had short presentations at 6 of 30 minutes each has already passed. And after this breakout plenary session, you will have other breakout sessions, 3 of 60 minutes each, followed by another batch of breakout session 2 of 3 also of 60 minutes each, and then the presentations. At the end of the day, there will be a marketplace, day 1 and day 2. The first marketplace will be for partner in immunization network, presenting what they are doing in terms of capacity building and networking. For the second day, it will be device manufacturers. All the proceedings and presentations of the conference, everything that will be presented here of the conference slides, videos, contact details can be found at the conference webpage with the link here. You can also use these two barcodes just to scan and get access to all the documents. For this opening presentation session, we have a couple of opening remarks. The first will be from Anne. Now I give the floor for Anne to provide her opening remark, and that will be followed by Robin. Anne, over to you.
Thank you so much, Solo. Do we have the next slide? I'm really delighted to talk to you today. We are going to have 2 days of really intense and interesting key discussions on very important topic around the immunization in the next 2 days. It's going to be virtual. It's going to be new for this TechNet as a format, but I hope everyone gives their best and with the same energy as if you would be in person and see each other again as before. There will be 2 days of discussions on these key topics, 107 presenters, many discussions, and it is very timely as well. Can we have the next slide, please? I don't have, there we go. What I wanted to say is that this is very timely as well. We have a new vision for the world in immunization, co-created by all stakeholders. And as you know, next slide is the Immunization Agenda 2030, which was endorsed by all member states just recently, which sets a unified vision for the decade, aligning this vision with many of the other global visions like the SDG, and it's translated into some very clear, specific impact goals. Next slide. The vision states that what we want is a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. And this translates each part of the vision into the impact goals, which are 3, the reduced mortality and morbidity from vaccine preventable diseases, for all across the life course. The second one is leave no one behind by increasing equitable access and coverage of new and existing vaccines. And finally, the last impact goal, ensure good health and well-being for everybody by strengthening immunization within primary healthcare, contributing to universal health coverage and sustainable development goal. Next slide. So this new agenda, it's being built up around 7 strategic priorities, which you see on the top figure. The dark blue that goes in as an arc is really about this strengthening immunization systems and universal health coverage, and placing and having immunization not as a separate system, but really integrated into the larger picture. We then have commitment and demand, coverage and equity, life course and integration, outbreaks and emergencies, supplies, and sustainability, and finally, research and innovation. Within each of these, there are strategic priority goals, there are key focus areas, and a lot of you have been involved in shaping the context of content of each of these different pillars, which will be placed on our website at the launch after Christmas in early 2021. Across all these strategic priorities, we have the core principles that goes across and are relevant for all the strategic priority. The importance of people-centered services, listening to and tailoring services to the needs of populations, having the countries at the center and being the drivers of all action, and having the partnership around aligned to the country-owned decision-making and priorities. The partnership-based means much, much larger than maybe before, and reaching to other sectors and other immunization. That's a way we can make immunization agenda work. And finally, maybe most important, the data-guided principle that is across all of them. Next slide, please. Okay, and next slide. I don't think we can use this. So I'm wrapping up with saying that it's not only the immunization agenda. This past year, life has changed so much in the light of the COVID pandemic, right? That immunization services are disrupted. There is a huge effort from all countries and partners on how can we restore and maintain and keep up immunization services during COVID. And then on the horizon, we also have a huge challenge, which is the new COVID-19 vaccines that are being developed, that hopefully will come out in millions doses. The estimate is that at least in the big global efforts to get these vaccines out to all countries in the COVAX Pillar of Act Accelerator, an estimated 2 billion doses that should be delivered to and accessible to all countries by the end of 2021. This means that the efforts that will be talked about over these next 2 days will be a lot on how getting those vaccines out safely to people and be delivered timely, safely, and well. And I think that many of you will have COVID in your eyes when you discuss over these years. This is a massive effort from all of us, and we need to do this smart and do it well. So I hope that for all of us, it will be a fantastic conference, and the importance of these topics over the next days cannot be underestimated. Good luck for everyone and enjoy. Bye.
Thank you so much, Anne, for this energizing word and the insight on the Immunization Agenda 2030. Now I will call Ruben for his opening remarks. Ruben.
Hello, everyone, and very happy to join you here on this virtual meeting. And thank you, Solo and Anne, for the very good introduction. this is unfamiliar territory for all of us to engage like this virtually, but this is going to be our way of doing business in the future. I think it's a really good time, as Anne says, for this conference as we we end and start a new, end a previous decade and start a new decade. And with our new vision now approved by the World Health Assembly in the form of Immunization Agenda 2030, as Anne and Solo indicated, we have to take stock of where we were in immunization, address the stagnation that we were facing prior to the COVID-19 pandemic. And then come the COVID-19 pandemic and the disruption that we faced and the backsliding that we will have to deal with. And then again, as Anne mentioned, preparedness for the COVID-19 vaccines. This will need us to work in parallel sometimes with interlinkages with one another, sometimes in parallel, but we will have to move on all three fronts at the same pace. This group is critical. And Solo, thank you for reminding us about the history which started in Cyprus in 1990. And a lot has been achieved over the last 15 iterations of this TechNet meeting. A lot of movement in vaccine management, in innovations, and everything you've done over the last couple of decades will be really critical in helping us to address the challenges that we face now. I want to hone on one particular topic, is that of equity and the stagnation that we have been facing over the last decade in immunization. This focus on equity, which is in IA 2030 very strongly, as Anne described, it is in the Gavi 5.0 agenda that you will hear from Alex, I'm sure, is even more important today than it was prior to the COVID-19 pandemic. We know that 20 million children are missing out the full complement of vaccines each year. We also know that out of these, approximately 14 million of them don't receive any vaccine, the so-called zero-dose children. Extremely important now, given that zero dose is quite firmly entrenched in our vision for the next decade, to identify, track, and vaccinate these zero-dose children. We have, therefore, the need to identify strategies, tools, technology to get vaccines to these communities. A major shift that for me that's important is the shift between the zero-dose child and the zero-dose communities. Zero-dose children are not randomly distributed in communities. They are clustered in certain kind of communities. And we need to identify, characterize, and plan services in these communities. So as you go through your deliberations over the next couple of days, it would be great if you could focus on the three kind of communities where we think we could get most of the zero-dose children. Remote rural populations, urban poor populations, and conflict-affected populations. The tools, strategies, and technologies to reach these three would be quite different, and it would be good to get our thinking around how we actually crack this stagnation and our inability to reach these zero-dose children over the past decade. As we think through this, I want to highlight the importance of three things: rapid scale-up, sustainability, and economic efficiencies. We are moving into a resource-constrained environment as we emerge from the COVID-19 pandemic. Make no mistake about it, we will need to look at efficiencies and more effective ways of doing business. Finally, I think also COVID reminds us the importance of taking the opportunity of this crisis to strengthen immunization systems, strengthen health systems, and promote overall resilience of the health system. I wish you all the best. I wish we could all be together in person, but in the absence of that, I hope we can make the most out of the virtual connection that we have with each other, and wish you all very good discussions and deliberations. Thank you very much.
Thank you, Robin, indeed, for your blessing of and providing us some of the critical area on immunization regarding attaining, reaching 0 doses will be critical for supply chain design in the coming. Now I want to call Alex for his opening remarks. Alex.
Good morning. It's a pleasure to be with you today. This is an exciting time for all of us in the Alliance as we stand on the cusp of Gavi 5.0, despite the many, many challenges that the world is facing right now. Before talking about those challenges, I wanted to start by recapping where we are and where we've come from and what we've achieved together as an Alliance since 2000. Over the last 20 years, the Alliance has immunized or helped countries to immunize over 800 million children through routine immunization, over 1 billion children through campaigns. We've helped support over 500 vaccine introductions and SIAs, and we've helped countries increase their coverage of routine immunization by 22 percentage points, cutting the gap significantly between the poorest countries and those in the rest of the world. As a result of all of these things, we've managed to prevent 14 million future deaths. This is an amazing progress. And I think one of the most startling statistics for me is that we now have coverage of new vaccines, such as pneumococcal vaccine and rotavirus vaccine, which are actually higher in the world's poorest countries than they are in the richest countries. We've helped make the world healthier and more equitable. But despite this progress, there are still 10.6 million children in the Gavi supported countries who don't receive a single routine dose of vaccine every year. That number hasn't moved very much between 2009 and 2015. In fact, it didn't move at all. And these children, I think that represents, are living in communities which are systematically missed. They're marginalized, and they're not a priority in many cases for health programs. It's these communities and equity which are therefore the priority for the whole Alliance as we move into our next strategic period. Just a few statistics on who those children are. 2/3 of them live below the poverty line. They typically live in communities with no access to health services. For example, 0-dose children are almost half as likely to have a mother who received antenatal care or institutional delivery, and 33% less likely to live in households with water and cleansing agents. They're often politically marginalized. They may not be politically registered or recognized, and they're also often home to gender and other acute social barriers to children receiving immunization and other primary healthcare services. As a result of those multiple deprivation, these children account for 50% of vaccine preventable deaths, despite being only 13% of the birth cohort. Since 2015, we as an Alliance, including many of the people on this call, have focused on improving coverage and equity of immunization. And that has helped to bring down those numbers. The number of 0-dose children has fallen by 14% since 2015. But we need to accelerate this progress further. The opportunity is ahead of us is to make immunization truly universal. With nearly 9 in 10 children now being reached by a first dose of a diphtheria, tetanus, pertussis containing vaccine, we really do have the opportunity to aim for universal immunization by 2030. And since immunization has a far higher coverage than any other health intervention, we really can be building a platform for universal primary healthcare and universal health coverage. Of course, COVID has been a huge disruptor, and it risks setting back years of progress in immunization and in many other health programs. We've seen that COVID has disrupted immunization across the world. About 3/4 of countries have just reported disruption to outreach services. About half of them have also reported disruption of fixed site immunization, and about 75% have indicated that immunization or demand for immunization services has decreased due to the pandemic. As an alliance, we have shown our strengths and on agility by being able to pivot to support countries in responding to this. We've already reprogrammed over $80 million of health systems support and technical assistance to help countries with that response. And I know many of the people in this conference are working closely with countries across the world to help them with that response. COVAX rollout and COVID vaccine rollout will be a critical part of the solution. And it's something which will be, I know, a priority for all of us going forward, and something which, as Benjamin will talk about later, we as an alliance are already working on very intensively. At the same time, it will be a further challenge for health systems that are already struggling with the impact of COVID, both in terms of the impact on health workforce and services that need to now respond to COVID, as well as deliver routine services, as well as the impact on communities and demand for those services. However, as we roll out COVAX, and as we help countries respond to the COVID pandemic, we also have an opportunity to help rebuild better. And that includes both strengthening the systems, the underlying health systems, including supply chains, which I'll come to in a second, as well as prioritizing those children in the recovery efforts who have been historically missed. So as we go into Gavi 5.0, it's both an exciting time and a challenging time. And our aspiration is to make real progress on the equity agenda, to accelerate progress in reaching zero-dose children, and do so while helping countries to respond to and recover from the pandemic. Supply chains have been a critical part of the progress that we have made historically. In 2014, the Alliance for the first time developed a dedicated supply chain strategy, and many people who are part of this discussion today were involved in developing that strategy. It was the first time we had prioritized this as an area, and it has had real impact. Nearly 30% of our health systems grants are now focused on supply chain strengthening, and that investment is driving improvements. Effective vaccine management scores on average have improved by almost 9 percentage points in this strategic period since 2015. And since the cold chain equipment optimization platform was launched in 2016, we've procured nearly 50,000 additional cold chain devices, which are helping to strengthen the cold chain. And 30% of those are going to facilities that previously didn't have a cold chain equipment. So making a real difference to the equity agenda. But when we developed that strategy, we didn't have an acute focus on equity in the way that we now do as an alliance. And so one of the questions for us as we go forward is, how do we ensure that our work on supply chain is really helping with that agenda of reaching those last children? Similarly, the COVID pandemic has both illustrated the resilience of supply chains, which with all the strengthening efforts that have happened over recent years, but also exposed some of the limitations. Understanding, for example, where vaccines were available and where they weren't, where the risks were in the supply chain in sufficiently real time to respond in the context of the pandemic was a challenge. As we introduce COVAX, the need to address that is going to become even greater. With a vaccine that will be highly sought after and very scarce, being able to ensure it's being used optimally, that the inventories are managed effectively, and that we manage the risks of diversion and counterfeiting will become increasingly important. So for both those reasons, as we look forward and think about the next alliance supply chain strategy, our focus is going to pivot from hardware to software. In this period, we've done a huge amount to build out the infrastructure of the supply chain, and that will remain important. But where we've seen less progress is around how those supply chains are managed, the data coming out of those supply chains, and the ongoing operations of the supply chain to ensure that they are working as effectively and efficiently as possible. Two examples of this. The first is end-to-end supply chain visibility. This will be critical, as I've already mentioned, for COVID vaccine, but it's also critical for an alliance that spends over $1 billion a year every year on vaccines, and and as part of the equity agenda, where we need to make sure vaccine is routinely available where it's needed. In this period, we agreed with manufacturers that barcoding will be available on every secondary packaging for vaccines. But the question for us as we go into the next strategic period is how do we leverage that and use modern technology to drive a real change, a step change in the end-to-end visibility we have in the supply chain to ensure that vaccines are available where they're needed, when they're needed, optimize inventories and minimize waste. A second example is around the maintenance of cold chain equipment. We've, as I mentioned, procured nearly 50,000 units of cold chain equipment in this period, but we know that maintenance remains a weakness in many countries, and that's demonstrated by effective vaccine management scores. How do we bring the same level of rigor and attention that we've had on the procurement of cold chain equipment to ensure that that equipment is then maintained and managed as effectively? And that will be a real challenge and is a real risk if we don't address it going into this strategic period. As we tackle these challenges, one key underlying question for all of us will be around integration. What is our approach as an immunization community to integration? How do we think about integration with other health programs? For example, how do we ensure that we have a joined up approach to end-to-end visibility across supply chains and not end up with multiple electronic logistics management information systems in countries? How do we think about integration with the private sector? Could they help us with cold chain maintenance, for example, where they may be better positioned to do that effectively than our current approaches? And how do we think about integration with primary healthcare more broadly? How can solarized cold chain equipment, for example, provide the foundation for solarizing health facilities more broadly? With IA 2030, we've all agreed that equity is the organizing principle for us as an immunization community going forward. Supply chains and strong and robust supply chains will be a critical part of that. And I think some of the opportunities that you will talk about and some of the themes that you'll discuss over the coming days will be critical as we think about how do we ensure that vaccines are available where they're needed, when they're needed, efficiently, effectively, and sustainably. Thank you.
We have also had some presentations on word from MOH Senegal, the word from Dr. Ngom Ndiaye, Marie Khémesse, to provide her words for the TechNet.
La pandémie Covid-19, un grand choc sur l'humanité tout entière. Donc le Sénégal très tôt, en voyant ce qui s'est passé en Chine, le nombre de cas qui évoluait en termes de pneumonie, mais également qui s'est allé au niveau de tous les autres continents, s'est très tôt préparé dès les premières semaines du mois de janvier, en élaborant un plan de préparation qui était donc respecter les différentes capacités du règlement sanitaire international en termes de surveillance épidémiologique surtout, mais de surveillance des postes frontières. Pour la Covid-19, nous avions en tout cas prévu dans les prévisions que la porte d'entrée première allait être probablement les aéroports. Et vous avez vu ce qui s'est passé, nos premiers cas étaient des cas importés. Mais également en termes de renforcement des laboratoires. Parce que le diagnostic est biologique. Aujourd'hui, on parle de diagnostic scanographique avec le scanner, mais le diagnostic est biologique avec le test RT-PCR, mais également le test sérologique. Il faut dire que dans cette gestion des épidémies, ce qui est important, c'est la plus haute autorité qui a porté la gestion. Donc, très tôt, quand on a eu à commencer l'élaboration de ce plan de préparation, ce plan a été validé, mais également financé par le président de la République du Sénégal, son Excellence. Mais également, il faut dire que c'est le jour de la validation qu'on a eu le premier cas. Donc, nous avons basculé automatiquement sur le plan de contingence, qu'il faut dire, c'est un plan multisectoriel et multidisciplinaire. Mais également, vous savez, après Ebola, la crise Ebola, le Sénégal a commencé son plan de sécurité sanitaire mondiale. C'est important. Ce qui fait aujourd'hui également, au niveau du secrétaire général du gouvernement, nous avons ce qu'on appelle le secrétariat permanent du Haut Conseil de sécurité sanitaire mondiale qui nous permet de faire la liaison entre les différents sectoriels. C'est important parce qu'aujourd'hui, nous sommes allés ensemble. C'est pourquoi je pense que nous avons presque gagné ensemble. Mais également, tous les autres secteurs aujourd'hui sont au niveau de la lutte. Et dans l'approvisionnement, il faut dire que nous avons une centrale d'achat qui est la pharmacie nationale d'approvisionnement, qui depuis Ebola, quand même, gère un stock. Et ce stock-là, aujourd'hui, qui nous a permis, dès les premières heures, d'avoir des entités de protection. C'est important au moment où le monde entier en souffrait. Nous avions déjà un stock en termes de gants, en termes de visières, en termes de masques. Mais également, au fil du temps, nous nous sommes rendus compte, avec un autre secteur qui est le ministère de l'Industrie, à travers l'Agence nationale de normalisation, qu'on peut faire des masques au plan local, mais en respectant, par exemple, une certaine doublure. Et vraiment, cela, on l'a réussi également grâce à l'appui des universitaires. Aujourd'hui, nous avons des masques locaux qui arrivent quand même à retenir le virus, et c'est extrêmement important. Les gels hydroalcooliques également, nos étudiants en chimie, mais également des autres écoles polytechniques, ont pu, grâce à l'appui d'experts qui sont là, la direction de la pharmacie du médicament, à pouvoir créer des gels hydroalcooliques. Mais le dernier point, on a eu un cargo à la dernière minute, dans les 3 premiers mois, un cargo qui est également allé dans les autres pays, particulièrement la Chine, pour venir en appoint à ce que nous faisions. Il faut dire qu'il y a eu, comme partout ailleurs, cette peur de la maladie, si bien que nos centres de traitement étant au niveau des structures hospitalières, la population naturellement a eu peur de venir se faire consulter. Si bien que quand même au départ, on a eu des problèmes avec les maladies chroniques surtout, telles que le diabète, telles que l'hypertension artérielle. Mais heureusement, nous avons eu quand même quelques cas de téléconsultation. Mais également sur les activités de prévention telles que le programme élargi de vaccination, si bien qu'aujourd'hui, nous avons évalué à travers une supervision, mais également les différents rapports que nous recevions, que les indicateurs sont en train de baisser. Et naturellement, on est allé sur des stratégies spécifiques, telles que les stratégies de proximité concernant la vaccination. Aujourd'hui, il y a certaines structures qui vaccinent même les samedis matins, mais également aller donc renforcer l'offre, avoir une proximité de l'offre également a été extrêmement importante. Cette pandémie de Covid-19 nous a quand même montré qu'il faut barrer, enlever tous ces cloisons par rapport aux activités. Le système doit rester un seul, indivisible, mais très robuste pour aller vers une résilience. Et ce que nous sommes en train de faire aujourd'hui, c'est ne pas attendre qu'il y ait une épidémie. C'est vrai qu'on n'a pas attendu à 100%, mais préparer l'épidémie. Aujourd'hui, nous savons qu'avec ces changements climatiques, avec ce bouleversement des écosystèmes, nous allons droit vers des urgences de santé de portée internationale, mais également vers peut-être des catastrophes naturelles. Mais aujourd'hui, ce qu'il y a lieu de faire, c'est d'être en alerte maximale chaque jour et en tout temps.
And now, Benjamin, the floor is yours for your speech.
Thank you, Solo. I hope you can hear me well, and welcome everybody. I'm very happy to be part of TechNet again. It's a fantastic and great community, and these are like some of the best conferences there are in the world of immunization. So I'm really, really happy that we continue with this and that we do this now virtually, which is not so much fun because you cannot walk around and touch the latest tools and equipments that may stand normally in the background of the TechNet conference, and we don't have time for these really important side discussions. But let's try to get the most out of it. Can you project the slides then that I shared with you? Then I will talk about today about the issue of country readiness and the delivery work stream. Okay, I will talk about this now also without slides, and sometimes slides are distracting. So let's keep on the topic. So you've heard about COVID-19 vaccines. You've heard about the whole process of getting them out to countries and the establishment of COVAX for fair and equitable allocation of those vaccines for everybody that needs them. And we were kind of thinking about how do we prepare countries to drive this forward. At global level with WHO and Gavi, Gates Foundation and many other partners, we have established a working group to think about what do we need, what tools, what guidance, what approaches need to be ready to ensure countries can introduce the COVID-19s once they become available. And this group has identified different areas of work, from communication, advocacy, and training, to ensuring that data and monitoring systems are in place to ensure that there is a coordinated approach at country level, to very technical topics about how do we ensure that the vaccine introduction can go ahead with readiness assessments, clarity on how they will be deployed, and then issues around demand and acceptance. And of course, for the TechNet community, very important, the issue of supply chain, logistics, cold chain, distribution, handling of vaccines, and making sure that we don't only drop the vaccines off at the national level, but they really reach to the facilities that need them. So this is a major challenge, of course. And the challenge here is that never have we introduced a vaccine so quickly into so many countries. We've had, with the establishment of Gavi, there wasn't pickup of vaccines in general and more introductions in the low-income countries. There was, of course, the IPV introduction worldwide a few years ago, but we are talking about next year introducing a COVID-19 vaccine in the whole world, in all the countries. So it is a tremendous amount of effort that needs to take place, and we need to be ready, and we need to start being ready now. Our current planning horizon, and that's not a prediction of when vaccines will be available, that's really our planning process, we think that in Q1 2021, we will start deploying vaccines to countries. So we have got only a few months' time left to prepare those countries and make sure that they are ready. There's 2 points I want to raise here. Number one is we've developed a COVID-19 vaccine introduction readiness assessment tool. This is like a checklist for country stakeholders to help them plan and a roadmap ahead of what they need to do to be ready. And it's also a tool that helps them to monitor progress as they move along their readiness curve to ensure that they can introduce a vaccine. This checklist is not a detailed operation guideline in the moment, and I will come back to that one in a bit, because that will come in a short while. The contents of the checklist is really self-explanatory. It has 9 or 10 segments, from planning coordination to clarity on regulatory issues to points on surveillance and monitoring, and of course the issue of vaccine logistics and cold chain. Do we have adequate cold chain in place? Do they have adequate transportation systems in place? What do we need to do in terms of security for this vaccine? It is a vaccine like no other. We are targeting populations that the EPI systems normally does not target. They have to maybe get it to people that normally don't get the vaccine. And there's going to be scarcity in the initial month for this vaccine. So is it something that will imply we need to have a better eye in terms of where the vaccines are and tracking them? So I think in the vaccine logistics and cold chain space, there's a lot of work that needs to be done, and we count on the technical community really to drive this work forward to help ensure that countries are ready. We don't want to have a vaccine and then not having countries ready. That would be terrible. We really want to deploy these vaccines as soon as they are ready. And apart from this assessment tool, we also developed guidance for countries on how to develop a national deployment and vaccination plan. And this guidance of how to develop this NDVP will be shared end of October. Again, it includes elements on supply chain logistics, and experts are contributing to this. And if you're on country level, I really would like to ask you for two things here. Number one, engage with the WHO, UNICEF, other technical expert, government, also from the finance world, people into becoming ready and ensuring the country is ready. Have honest discussions where there are gaps. Use the checklist tool to identify where you stand, where you think you need to support, address those bottlenecks, and move forward. And leverage, really, you have a lot of expertise at country level. It's not the first time we are introducing a vaccine. It's gonna be slight different vaccine maybe, but some of the key elements are the same, and you have a lot of expertise and knowledge in-house in your countries that you can hopefully use. So thanks. Start preparing now. Only then can we ensure that the vaccine will be rolled out quickly. And over to you, Solo. Thanks a lot.
Thank you very much, Benjamin, for introducing this work on and the tools and guidance material that have been prepared at the global level to support countries. And I think that it's really helpful and country will have the most benefit. Now, my next presenter is young and special from Oman. The global pandemic has been a rally call for young inventors and entrepreneurs across the world. Young people are eager to contribute their talent and passion to helping those in need and making society more resilient. Saada Al-Safdi is team lead of Team Teryaq, the winner of Oman Youth COVID-19 Innovation Challenge. It was held in June with support from the Oman Technology Fund and UNICEF to engage young local inventors and startups with the goal of creating solutions for health and education sector that are rooted in technologies. Saada, please your words for this TechNet conference.
Thank you, Solo. Thank you, everyone, for the great topics and discussions. So pandemics have always been an obstacle to humans' well-being, society's health security, and nation's development, going back to the very beginning of the history. And coming forward to the current year with COVID-19 pandemic, we could observe the considerable damage happened to the individuals, companies, and countries. Therefore, an idea came in alignment with the huge impact of COVID-19 to the health sector. This idea will help people get their medications whenever needed in a timely manner without being forced to take the risk and visit the pharmacy, because pharmacies can be considered as one of the places that could have high potential to spread the virus due to low physical distancing between the customers, especially in small and busy pharmacies. In addition to that, there is the possibility of having service contamination caused by COVID-19 patients while obtaining their medication from the pharmacy. Furthermore, the statistics in Oman shows that almost 82% of people are not able to obtain their medications occasionally due to some circumstances that all revolve around the inability to reach the pharmacy. Unfortunately, this percentage might increase during the pandemic. So it will definitely hurt the medical stability of the country. So Teryaq came as a solution to this problem by providing an easily downloadable application where pharmacies can display all of its available medicinal and non-medicinal products, allow people to order and deliver it to their doorstep after the pharmacist's approval of the product compatibility to the patient's medical conditions, then deliver it to their doorstep while maintaining the international medicinal transportation conditions. Furthermore, the application will provide free medical consultation with high reliable authorized pharmacists through the immediate online live chatting. So this application will help people get most of their pharmaceutical products and services online. This will definitely help maintaining social distancing, prevent the spread of COVID-19, and help people get their medications whenever needed without delays that might result in future medical complications. So unfortunately, due to some governmental restrictions regarding the transportation conditions, medicinal transportation conditions in Oman, we have reconsidered the idea to include a wider segment rather than focusing only on patients. So rather than only displaying and delivering pharmaceutical products, we have considered other shop categories, as also other shops can be considered as one of the places that could have high potential to spread the virus. So therefore, we will include a wider segment. We will maintain the social distancing by including a wider segment rather than focusing only on patients. So finally, we could say that COVID-19 has brought about many challenges as well as opportunities for the future, especially across the technology sector. Individuals and businesses have been looking at technology to help them meet the challenges presented by the pandemic. So our goal is to invest in supporting the move towards online technology, online services as a key step in helping restore our society's health and country's economy in the current and possible future pandemics. Thank you again, Solo, for the introduction, and thank you everyone for the great topics.
Thank you so much, Saada, for this exciting experience you've conducted in Oman. I'm sure that the world now has become new technologies, and I think you will inspire many other young generation just to implement, to do that, to join these efforts.